Are you talking to me? Are you talking to me? No way, Paul.
Hello everyone, Venomous here. Go right into it. Why is it not showing? Here we go. Let me just adjust the size real quick. Still not good size. Sorry, I thought I had it ready. Where is it? I just lost it. How's that? Better. Okay, so just saw this earlier on Twitter. NB COVID-19 Roundup Winter Plan goes into effect Saturday night. 2 deaths, 97 new cases. This is New Brunswick on CBC News. 3-level plan will remain in place until spring. Indoor gatherings limited to 20 people. Health Minister Dorothy Shepherd and Chief Medical Officer of Health, Dr. Jennifer Russell, both urge people to keep their numbers of contacts as low as possible this winter, noting the province continues to see significant spread of COVID through household gatherings. Government New Brunswick YouTube. The New Brunswick government released its winter action plan for COVID-19 on Friday as it confirmed 2 more COVID-related deaths and 97 new cases in the face of a very concerning rise in infections over the past 2 weeks and a disproportionate number of cases among the unvaccinated. Health Minister Dorothy Shepherd said the 3-level plan with new restrictions will take effect Saturday at 11:59 p.m. It will remain in effect until spring, she said at a live-streamed COVID-19 event, COVID update. The entire province will be in Level 1, the lowest level of restrictions, when the plan takes effect. It includes the following rules and guidelines. Maximum of 20 people for informal indoor household gatherings. This replaces the current steady 20 restriction, which health officials told CBC News actually poses less risk but wasn't enforceable, and some people were having difficulty keeping track of who their 20 consistent contacts were. Maximum of 50 people for informal outdoor gatherings. Unvaccinated residents should avoid informal indoor gatherings. Masks are required in outdoor public spaces when physical distancing can't be maintained. Here's the kicker. Malls, grocery stores, salons must enforce physical distancing or may instead require proof of vaccination from all patrons. Yes, people, it has come to Canada. Where's your papers? That's not even a German accent. It's terrible. Anyways, they give the option for the COVID pass in grocery stores, just like we said was coming last year. Schools will follow existing plans at this time. All travelers, include New Brunswickers returning to the province, must register or have a multi-use pass. Unvaccinated people entering the province are required to isolate and take a test on day 10. All travelers arriving by air will be provided with a rapid testing kit. With winter comes colder weather, shorter days, more time spent inside, and increased opportunity for COVID-19 to spread, said Shepherd. It is important we have a plan in place that ensures our healthcare system is not overwhelmed, but also considers the mental, physical, and financial health of New Brunswickers. wickers, unless, of course, they're unvaccinated, then we don't really care about their health. The measures are not difficult, she said. They are small actions that each person can take, but when combined, can make a big difference. Oh yes, it's called starvation. Pretty big difference. If carefully followed and combined with public health measures such as wearing masks, physical distancing, and scrupulous hand washing, Shepard said she is confident that the plan will keep case numbers under control. The power to keep us in level 1 is in our hands. Dr. Jennifer Russell, Chief Medical Officer of Health, warned Christmas gatherings could lead to a post-holiday spike in cases. Absolutely concerned about that. And obviously, with this new variant of concern, the moronic, it's even more challenging in terms of what the scenarios could look like. By releasing the plan early, 3 days earlier than scheduled, the government is giving residents a few weeks to make personal decisions around managing risks to protect their communities and the healthcare system. There you get your number 3. And the early warning is really just to get you getting you comfortable with the fact that you will be even more restricted. And that's how they manipulate you. And I lost my place by doing that. If necessary, the Winter Action Plan has 2 more alert levels with increased restrictions, including household bubbles. Yay, bubbles. Lower capacity at restaurant and no travel in or out of level 2 or level 3 areas except for essential reasons. Some criteria that could prompt a change levels includes the 7-day average of new cases, the rate of positive tests, hospitalizations, and the impact of contact tracing, said Russell. Health officials would consider a move to level 2, for example, if there is a positivity rate of 10% across the province or in one zone, if 70 people are hospitalized or 34 people are in intensive care, and if public health resources are unable to contact cases or sites of exposure within a reasonable time frame, she said. To move from level 2 to 3, there would be 15% increase in the positivity rating provincially or in any single zone, 100 people in the hospital or 50 in ICU, an increasing 7-day average of new hospital admissions, and public health resources would be unable to maintain and manage contact tracing. So there's more information on the government site. Enforcement of gathering limits will likely be random, said Shepard. Public safety officers will focus mostly on those who have been directed to isolate, she said. On the whole, I think people will be compliant because they're good little sheep. Anyway, so let's go to the PDF to see how the levels increase. They don't really tell you that much, but let's make this a bit too far. Alright, so we got your level 1. We already read through. Bubble, social gatherings. Level 2 is a 2 household bubble. Level 3 is a single household bubble. Masks. Mask mandatory indoor, outdoor, yada yada, same as 1 and 2, or 2 and 3, I mean. Restaurants, patrons must show proof of vaccination or medical exemption. Patrons must remain seated. Level 2, patrons must show proof of vaccination or medical exemption. Dine in with 2 household bubbles only, 50% capacity. Level 3, drive-through takeout and delivery only. Business retail. Open with physical distancing of 2 meters or can require proof of vaccination for patrons 12 and older. Level 2, open with 50% capacity in addition to level 1. And level 3 is essential retail only. Non-essential retail is contactless pickup or delivery only. Gyms, we don't care about gyms. It's usually the same old crap. Spa, salons, don't care. It's all the same nonsense. Entertainment, proof of vaccination, open. Second level is open with proof of vaccination, 50% capacity, and closed if it's level 3. So level 3 for those last 3 were closed. School, daycares, Level 1, refer to healthy and safe school guidelines. Level 2, refer to healthy and safe schools guidelines. Level 3, refer to healthy and safe school guidelines. Okay. Faith venues. Level 1, patrons must show proof of vaccination or medical exemption or physical distancing operating at 50% capacity. No singing, collecting names, or attending of attendees by row, or having a consistent assigned seating plan is required for gatherings without proof of vaccination. Level 2, 50% capacity, no singing or choirs. In addition to Level 1 requirements, Level 3 is outdoor, virtual, or in-car religious services only. Recreation sport, Level 1 permitted. 2, permitted with 50% capacity for spectators. 3, not permitted. Travel. Oh my god, it's too small. I gotta zoom in there. Travel. Level 1. All travelers must register travel or have a multi-use pass, including New Brunswickers returning to the province. Unvaccinated people entering New Brunswick are required to isolate and take a test on day 10. All travelers arriving by air will be provided with a point-of-care rapid testing kit. International travelers must follow federal government testing and isolation guidelines and require testing on day 5 and day 10. Level 2, no travel in or out of Level 2 or Level 3 areas or communities other than for essential reasons. Work, school, health services, childcare, or child custody. Level 3, same as Level 2. Contact tracing and isolation. Level 1, isolate and test any high-risk close contact. Vaccinated household contacts must isolate until receiving a negative day 5 diagnostic PCR test. If negative, they no longer need to isolate, but they still require a test on day 10, of course. Level 2, isolate and test any high-risk close contact. Vaccinated household contact must isolate for 14 days or as directed by public health. Level 3, isolate and test any high-risk close contact. Vaccinated contact outside of household must isolate for 14 days or directed by public health. So that's the winter action plan. Of course, they would do it during winter, where they would, where there's no food to be grown outside, no access to food other than the stores or what you've stocked up on. And if you don't have a good stock, well, I guess you have two choices. You better hope that grocery store doesn't want to vax pass you. They want to give you the Kobe pass. But yeah, I called this freaking thing last year. Here, I actually recently tweeted about it because I had saw a post about what they are doing to India, which is even worse. But as I said last year, on November 10th of 2020, what they have been conditioning you, it shows the lineup at Costco, similar to the lineups of the Russia back in the Holodomor. What they've been conditioning you for this year, the grocery store will be replaced with the local food hub. Better come with your papers and check and vaccines up to date. And it was regarding this post. And we'll just glance at it. Wait for it to load. Here we go. Only inoculated people can buy groceries, fuel. Aurangabad issue order to boost vaccination. The order stated that only those who have received the first dose of the Kobe, there's so many things we can call it, the secret sauce, will be allowed to make purchases in Aurangabad. In order to boost the vaccination drive in Aurangabad, Maharashtra, the district administration has come up with a unique solution. Oh yeah, unique, cruel solution, yes. As the district collector passed an order stating that only vaccinated people will be able to purchase groceries, ration, gas cylinders, and fuel in the district. The order stated that only those who have received the first dose of the COVID-19 vaccine will be allowed to make purchases in the district after providing their vaccination certificate. Only vaccinated individuals can buy groceries, fuel, and gas in Aurangabad. The officials on Wednesday informed that the decision was approved by the district collector, Sunil Chavan on Tuesday night, where the authorities of the fair price shops, gas agencies, and petrol pumps manager were directed to check the vaccination certificates of customers and then sell the product to those who were at least vaccinated with one dose. The order further instructed the sellers to ensure strict compliance with the instructions and said that strict action would be taken if found flouting the same. Quote, speaking on the same, Aurangabad collector Chavan said, if the order is not followed, the administration will take action against the persons concerned under the Disaster Management Act and the Epidemic Diseases Act, he said. Earlier, the collector has passed an order to dismiss unvaccinated people from visiting tourist destinations and historic monuments in Aurangabad. The decision was announced after the vaccination figures of the district were found to be low. The collector has then placed a ban on the entry of unvaccinated individuals in order to push them to take the jab. Because if something's so good, you just have to starve people to take it. Because it's so highly effective. It's such good stuff. You gotta force people to take it. Other measures to boost vaccination in Aurangabad. While speaking to the PTI on the same, an official told the administration had also extended the vaccination drive in the state to evenings in order to provide people with more time to get jabbed. The official added that the decision was taken after considering that most of the people in the state worked in fields during the day. Yeah, providing you food. Many people work in agriculture fields from morning to evening. Hence, to facilitate their inoculation, the Zilla parish with undertake vaccination from 5 to 8 p.m. in the district. The Zilla Parishad's health official Sud Hacker Shekel told PTI. According to the health official, the first such campaign was held on Tuesday in Kanganin village, which is located in the Aurangabad, oh my god, the names, I can't say them, district border, and 100 doses were administered to people. The Aurangabad district administration has taken significant measures to improve the pace of the vaccination in the area, as only 55% of the eligible population has been vaccinated so far, as compared to 74% in the entire state. At present, Aurangabad ranks 26th in terms of vaccination among 36 districts in the state. Yes, people, they will starve you. It's coming to Canada, and we're getting a little taste of it. Oh, I just lost my thing. Getting first taste of it in New Brunswick. But, I mean, I told you, man. I kept telling you to stock up. So, I mean, I know my listeners are smart people based on their comments. They were probably well aware of this as early as I was aware of it, and have already taken measures to stock up if they can, if they have the means to. I mean, screw it, I rack up debt to stock up. I don't care, man. When everything goes to what's gonna be more useful to you? Food in your pantry or a credit card, or money in the bank? It's gonna be useless. So it's better to have food than to have those things. I mean, anyways, quick report. I just wanted to get that out there. Please share this information. Share this video. It's up to you. I thank you so much for your time and attention. Want to help out this channel? There's links in the description. Anything else? Nope. That's everything. Thank you so much. Reporting from the brave new world, I am Benominous. Catch you next time.